Hello friends, welcome to my channel Dietetics Notes. Today I am going to tell you about topic burns. So friends, today I will tell you about burns categories, complications, flow and recovery period, dietary treatment. So let's start. So, friend, what is burn? Burns are the injuries to tissues which can be the result from heat, electricity, radiation, or chemicals. So, the injuries which we get from heat, electricity, or radiation or chemicals, and that injuries are called burns. So, if the burns are caused by liquids, hot liquids, heat, such as fire, steam, or tar, that burns are called thermal burns. And the burns that are caused by the radiations, chemicals, suppose if you are working in lab or from there you got burned from chemical, then that burns are called chemical burns. It can be happen through electricity also and radiation also. See, this type of burns in which blisters form, these burns are called thermal burn, and this type of burns are called chemical burns. Now, friends, what are the classification of burns? So, burns are classified into three degrees: first degree burns, second degree burns, and third degree burns. So, friends, first degree burns are in which redness occurred through that is the first degree burns are very minor burns in which only the skin got red, and that burns heal by itself. But second degree burns happen when the blister form in the skin. That burns are called second degree burns, and third degree burns are those one which are in the depth of 1 inches in the skin. That burns are called third degree burns. So first degree are very mild, which heal itself. Second are blister formed burns, and the third is which is 1 inches deep burns. That burns are called third degree burns. You can see here, this is our skin outer layer, epidermis, and if the only epidermis lighter minor burns, it called first degree. And if it slightly penetrate and the blisters form, then it is second degree. And if it is 1 inch deep, then these burn are called third degree burns. What are the complications of burns? So, friends, see, first degree burns are very minor and they don't need any treatment. It heals on their own. And the second degree and the third degree burns need time to heal. So, severe third degree burns can result in severe complications due to extensive fluid loss and tissue damage. When third degree burns happen, then extensive fluid loss and tissue damage happens in our skin. In that severe burns, it takes 1 hour time to develop. Young children and older adults are more seriously affected by the complications than the other age group. So see, the children are very sensitive, and older adults are also very sensitive. So they are much affected from third degree burns, and third degree burns are take more time to heal as they are very severe. Now, friends, we will talk about the dietary management for burns. See, I have written the points also here. Nutritional support needs are calculated on the basis of body surface area burn. So, the nutritional support which we need to give to the patient, in that it depends upon the body surface, that how much the burn has been happened to the person. Second and third degree burns covering 15 to 20% or more body surface. If the burn is covering more than 15 to 20% surface of the body, then it comes in second and in third degree. But if the burn is less than 15 degree, then it comes in first degree burns, and they don't need so much of support. They heal on their own. So friends, you can see here 10% in children and elderly person cause extensive fluid loss and therefore required intravenous fluid therapy. If suppose a children or an elderly old person got severe burns, it comes in the category of second or third, then they need the treatment of intravenous fluid therapy. In this, the doctors provide the medications and nutrients through vein. So, patient with extensive burns needs immediate fluid and electrolyte replacement during the first 12 to 24 hours after injury. When the injury happens, so the patient need those who patients suffer from the extensive burns, they need the immediate fluid and the electrolyte replacement therapy within the 24 and within 24 hours. Now, friends, we will talk about the nutrient requirement when the burns happen to any person. See, friends, during burn, if it is severe burns, it comes in the second or third category. Then lots of fluid loss in our body, and in that case, the person need a proper diet. So the first macronutrients, the main thing which comes in diet is carbohydrate. So what we have to see that the person who is suffering from the burns category, so in that we have to give them the liberal amount of carbohydrate, means like if suppose total energy, the total calorie which he is or she is taking, and that 60 to 65% of total energy has to be given through carbohydrates. And we have to give the carbohydrate in the simple form or in the complex form, like we can give them rice, refined wheat flour, semolina, sago, arrowroot, rice flakes, pasta, potato, honey, etc. So we have to provide it liberally in the diet. So, friends, the next macronutrient is fat. So, friends, in the burn category, we have to give the low fats to the person who is injured. A low fat diet is preferred during the initial phase of recovery in view of its association with improved respiratory functions, reduced incidence of pneumonia, faster recovery. So, friend, in this point, it is telling that the person who comes in the burns category has to be given low fat diet in the initial stage. Then the another macronutrient is protein. So friend, the protein requirement is very high when it is the case of burn, because in this the person loses the protein in wounds or urine. So increased requirement. So the first point in this, you can see protein requirement are high due to increased losses through wounds and urine, increased requirement for promoting synthesis of blood proteins and wound. So, friends, the requirement of protein comes high when it is the case of burn, because the person loses the protein in the terms of wounds and urine. So, the requirement is high. Adult patient should be given 20 to 25% of the increased energy from protein. So, if the person is in the burn case, in that he or she has to be given 20 to 25% more protein than the normal diet. Children should be given 2.5 gram to 3 gram per kg usual weight of their protein per day. If the children is if we are giving the diet to the children, in that we have to give them 2.5 gram to 3 gram per kg of their body weight per day. So what comes in protein? What we can give them in protein is like we can give them eggs, meat, cheese, yogurt, marine food, poultry, legumes and pulses, soybean, etc. We can give them in the liberal amount, which in the easy digestible form. Now, friends, comes vitamins and minerals. So it is recommended to the person to give the plenty of fresh fruits and vegetables in an oral intake which is feasible, and supplements of calcium, phosphate, and zinc and iron should be given to the patient as per the doctor's recommended. Now, friends, the other consideration which we have to keep in mind is that the patient in this time when the patient is burned, then he need the mental support. So, because he or she may be mentally depressed, so the family duty and the medical team duty is to make him happy and to give him the complete rest, and so that the person can take the adequate food consumption. So friends, thank you for now. It is this much. If you want to know something more about this topic, you can ask me. I will make more videos about it. Thank you.